Institute for Communicable Diseases says that less children who have been affected by COVID-19 have been hospitalized. The NICD says 9% of children have tested positive for coronavirus since the beginning of the year. The report comes amid concerns over the upcoming return of children to school. Primary school learners are set to resume daily class attendance from July the 26th as part of South Africa battles a third wave of COVID-19 infections. Let's discuss this further. We're now joined via Zoom by Professor Refiloe Masekela, a pediatric pulmonologist and is the head of the Department of Pediatrics and Child Health at the University of KwaZulu-Natal. Prof, a warm welcome to you. Thank you so very much for agreeing to speak to us here on SABC News this afternoon.
Thank you very much, Flo. It's a pleasure to be with you this afternoon.
You know, Prof, there's been so much different word and perhaps it's the right time perhaps to get some sort of clarity from you in terms of, when it comes to children, how infectious are they? You know, we hear that they are carriers and that they're not necessarily badly affected in terms of infection rate by this virus. Can you give us some clarity as to what exactly is the situation with children? Are they indeed carriers of the disease who don't really feel the impacts of it?
Okay, I think, Flo, from what you've just mentioned in your preamble to this, was we know that children make a very small proportion of infection of people who have infections in the community. Mm-hmm. Now, that's related to a number of factors, most of which we're not 100% clear about. We know that children do get infected with COVID-19, but we do also know from studies that the viral load, that is the amount of virus that they carry when they have the infection, is probably lower than we do get in adults. So this doesn't mean that children are immune to the condition. It just means that they're not as good at transmitting the virus from person to person as adults are. Adults seem to be more efficient in transmitting the virus between themselves and other individuals. And secondly, we do know that children don't seem to have more severe disease if you look at them proportionally compared to adults. So even if they do get the infection, they don't transmit the virus as easily, and they don't get as ill as adults do. And we see very few of them then requiring hospitalization for COVID-19.
And Prof, how can this be explained? How can this be explained sort of easily? You know, whenever I think about coronavirus, I try to draw some kind of similarities with the HIV virus. And we know that if, in the past when children did get, HIV, they quite quickly got very, very ill, unlike the case that we're seeing now with COVID-19. So maybe you can explain to us, those vast differences, obviously in layman's terms, so that we can sort of understand as to why, when it comes to this particular virus, their viral load is lower, and that they're not necessarily immune, as you say, of course. But maybe you can explain to us in those terms in an easier way.
Okay, so there's a number of factors, and I'll just try to explain a few of them. Yeah. One of them is we know that in order for the virus to enter into the cell, so perhaps the HIV virus is not perhaps the best model to look at if we compare this to other perhaps respiratory viruses.
Yeah.
So in order for the virus to gain entry into the body, it needs a specific receptor in order for it to gain entry into the body. And we know that children have lower loads of this receptor. So number one, they don't easily get infected by the virus because they don't have higher levels of that receptor. And secondly, there's also many other reasons which we're not quite sure of. We know that children have many more viruses in their upper airway, for example. So there may be competition between viruses. So then it's not so easy for COVID-19 because it has to compete with the whole viral soup that children would have in their upper airway.
Right.
So all these factors we think may be linked to why children don't get as easily infected. And then when they do get infected, the load of the virus in their body is much lower. So it's for all these various factors that we think that we postulate why children are not as efficient at transmitting the virus and actually don't get such severe disease. But that doesn't mean that children are immune to the disease. We know that children can get severe disease as well, especially if they have comorbidity.
Yeah, and that's where I wanted to go with this. I mean, if a child does get quite ill from COVID-19, surely that then is some sort of a red flag, isn't it? Because could that be for a parent an indication that there's something else that's underlying that's making that child really sick in comparison to what other children, how other children's immune systems would be dealing with the disease?
Okay, no, I don't think we should confuse the two issues.
Yeah.
Okay, so like in the normal population, as an individual, you, Flo, can get SARS-CoV infection. It can be mild, it can be moderate, it can be severe.
Yeah.
Your risk of having severe disease would be linked to perhaps if you have other comorbidities in yourself. But having mild or moderate or even severe disease doesn't necessarily mean that you have a comorbidity. We know that completely healthy, previously healthy individuals get severe COVID-19. So I think we shouldn't conflate the two issues. Yeah. But we know that children that actually do require hospitalization, we have seen that it's usually the younger age groups, the younger children, those are the ones that require hospitalization with COVID-19. And we also know that children that have comorbidities are the ones who do also present with severe disease. That is true. Yeah. But again, we also need to remember that people who are previously healthy can also get severe COVID-19. It doesn't exempt them from getting severe disease.
Prof, just in closing, as we wrap up our conversation, obviously a lot of talk around vaccine, and one wonders from the discussions that we're having at the moment if there is a point to vaccinating, children from COVID-19. Would that be, and obviously a lack of better terminology here, would that be quite pointless in terms of wasting resources where we could rather be vaccinating those that are older in society and have those comorbidities as you point out?
Okay, not at all. But the issue about vaccinating children is because we are looking with vaccination to get herd immunity. So the more people in your population you can vaccinate, the better you are, right? Yeah. But the issue is currently we don't actually have any vaccines that are licensed for children under the age of 12. So there are studies ongoing. There's 3 vaccine trials that are currently ongoing for children below the age of 12. So the current licensed vaccines are actually, the Pfizer vaccine is licensed for children 12 and above. So they are, because in your population, you really would like to vaccinate as many people as possible. And we have also seen that in the pediatric age group, it's usually the very young children and the slightly older children and adolescents. Those are the ones who actually are the ones who have high admission rates to hospitals. So you would really want to cover those adolescents as well as the children, the older age group, with a vaccine. So I think should a vaccine be available that is able to be given to even younger children under the age of 12, that should be given, because particularly looking at schools, those adolescents also behave slightly more like adults, and that is the age group, the target age group you'd really want to vaccinate in order to prevent transmission of disease for children themselves as well as the teachers and the other people working in schools.
Prof, thank you so much for that education that you gave us today. Very informative indeed. We appreciate your time. Thank you.
Thank you very much.